right, let me welcome everybody. Good afternoon, everybody. I'd like to thank you all for joining us live. My name is Jesse Gallup. I am the founder and CEO of the Coding Nurse LLC. And what I primarily do is I primarily work with nurses who are in the process of trying to move away from the bedside, and I teach them medical coding so they can use their clinical skills in a new way to transition into the industry of health information management. And joining me this afternoon is the CEO and founder of ACDEN for Educational Consultants, Ms. Raquel Wilkinson Alston. So Raquel, introduce yourself.
Yes, so I am an educational consultant with ACD4N, and I am educational consultant focused on preparing nurses for life away from the bedside. We have a shared goal with that, myself and the coding nurse, because both of us really understand the importance for nurses to have options away from the bedside. Nursing is extremely dynamic. However, we recognize also, specifically as it relates to medical coding, that there's limited exposure, especially from the classroom space. So oftentimes, the option for to become a medical coder is not one that a nurse really hears about during nursing school. I don't even think it was ever mentioned at all when I was in nursing school. So so that's a passion of mine as well. So you can visit me at www.acd4n.com. That is my website to learn more about my services. But again, I am an educational consultant, and my goal is to help nurses transition from the bedside and explore other options in healthcare.
And Raquel and I had talked a while before about just the mindset that a nurse has to have when he or she is transitioning away from the bedside, and especially into a career like medical coding. Because believe it or not, medical coding is just as technical as nursing. Like you really, really have to have your rules and regulations, your guidelines. You have to master that craft just like you had to master the nursing process and all the other skills you needed for nursing. So um, since both of us have experience working with nurses and having them transition away, so I thought it was a good idea for us to talk about an article. But I wanted us to mainly talk about our experiences so far, like what we have encountered, like who we have encountered, the type of nurses we've encountered, and the type of mindset that we have encountered thus far in helping nurses transition away from a nursing mindset to a medical coding mindset. So, Raquel, what has been your experience so far?
So oftentimes what I find is so you may have nurses that really love the options and the opportunities that come in nursing to work in different settings, inpatient, outpatient, care management, case management. And I find that a lot of nurses are really excited about those opportunities, but I find that especially now, that nurses are complaining more about burnout. And I don't know if a lot of that has to do with the fact that, in light of where we're at now with the pandemic and everything, if there's just been such a demand on nursing just in general, where you see nurses really just saying, I don't know if I want to stay in this career any longer, or if I'm going to stay, it has to be on my terms. So I'm finding that nurses are becoming more selective about where they work. It's very selective about what they do. Of course, money is always that motivator for them to stay or leave. But I'm finding nurses um, are not as quick to have money be that deciding factor. Like it's an option it's a factor rather that's always a part of their decision making. However, I'm finding that nurses are really trying to think about more long term, like even if I do this for this year, like, having a real 3 or 5 year plan in place. Some by the end of the year, they're starting to already figure out, maybe I want to go back to school. They're trying to really look at what other options are out there because, again, like I'm saying, I think it could have something to do with the pandemic, but I'm finding that a lot of nurses are kind of they've become had like a almost like a reality check.
Right.
Yeah.
Now, for me, like because I've been doing this now so far for about a year and a half, and I always have everybody who enrolls in my classes. I always talk to them. We have conversations. I get to know what it is because I always want to know what is your outcome, so I can help you manage your expectation and help you and give you direction to how you need to maneuver to accomplish your end. And most nurses who come into medical coding have no idea how to even get into it. All they know is that they've heard about it and they're interested and they know that it's a way to get away from the bedside. That much they do know. And like you said, they're not so much concerned about money, although money is top of mind with everybody working because they know that if push comes to shove, I can always go back PRN somewhere to supplement. But they definitely what they're very clear on is they're very clear on they don't want nursing to be their primary source, and they're interested in more work-life balance, and they're interested more in being able to work from home and just be relaxed. Like it's a very nursing is a very the medical profession is very stressful. So I find that they want that kind of of alternative, to a work environment. Now, in terms of skill, what I find is like every what I tell every nurse before they start in my course that you have to take it seriously. Like there is a lot of ego in the nursing profession. Like nurses become insular and we think like the world revolves around nursing. And there's a certain way to think as a nurse because they train you in nursing school. But when you try to work outside of nursing, you have to put that way of thinking aside. And mostly every mostly everybody comes to medical coding as a nurse thinking it's a piece of cake. They think, oh, well, how hard can it be? And they think it's just really just looking up codes in a book, and it is so much more than that.
Of
And
course.
I I always have people drop out. I always have people withdraw from my class because it's not for the faint. Like I explained to them, like we dig in day one into the guidelines and we go into the deep end. And I tell them you have to study at least 30 minutes a day. And they think it's a joke. And then like week two, week three, they're really looking like their heads are swimming because they haven't learned the guidelines. They haven't put the time in. So when you're trying to talk about the cardiovascular system and diabetes and PVD and CKD, they are like, what in the world is going on? But you have to, and it's all because they come into it not taking it seriously. That's what I find, and I always find that it takes at least like 3 weeks for them to have their butts handed to them for them to really snap out of it. Some do, some don't.
I think it's such a good point that you're making because it's definitely one of those situations where I can see a nurse saying, why. So my experience is that nurses will be very intrigued and interested in learning about medical coding. However, once I start talking about the guidelines and once I start discussing um, the commitment as far as the hours of commitment for study, then I start to get a little bit more, oh, yeah, that's not really, something I really can do. That when I say commitment to hours, I want to be very specific. I have never, ever directed any nurse to pick up, purchase the guidelines, download the guidelines, and read them and call me if you have questions. Never anything like that. So when I'm saying that I'm experiencing some hesitation, the hesitation, it looks like it's coming from my explanation of, yeah, well, this is going to be similar to kind of like when you were a nurse in school and they start wondering, oh, well, I didn't know it was like that. I was thinking it was just going to be like, some ancillary thing. And to me is if you have no idea about what medical coding is, you should actually approach it with an open mind, assuming that it is an industry that is going to require, just like you mentioned, discipline and understanding about um, what the impact is and the role you will be playing as a medical coder in like the entire revenue cycle. Also, the role that you play within healthcare, within industry. So I feel like if a nurse is already telling themselves like, I don't know if this is going to be the right thing for me. I'm not really one that's going to push, because I feel like when you are ready, that is when you're going to be ready and willing to make that commitment. And that commitment is going to be you really saying to yourself, you know what? I see this terminology here. I seen this word here, and I'm wondering what does that word mean. Let me go research that. Okay, CMS has a write up on um some new guidelines, or there's going to be some changes coming down, like for instance the new changes with E&M coding. Okay, well, let me look into that. So if you see a nurse actually jumping and doing that kind and coming back to you with some explanations or coming to you with some understanding, then you already know, okay, you're in the right space because there's so much information online. I don't expect someone to go searching for information on the web and answering all these questions for themselves, but I do expect for you to have some level of curiosity and for you to demonstrate that commitment through doing research, because it will require a lot of reading. And if you are really committed to learning, for me, I'll tell you this: I'm not afraid to go onto YouTube. I will sit there and I will listen to a panel of CMS professionals sit there, go on and on and on. I'll listen to coders talk. I'll listen to consultants speak. I will listen to individuals talking about the industry, talking about the work they do, talking about the impact, changes are having in healthcare and the revenue cycle. I will listen to those discussions. I find that if nurses are committed to the studying, they will be open to different modes of learning. This is similar to nursing school. When you're in nursing school, your teacher will give you the PowerPoint. They may send you videos to watch. They may tell you that there's downloadable videos that came with your textbook. They may give you some exercises, some critical thinking exercises, maybe some little essay to write, maybe a paper to write, maybe a nice, 10, 12-page paper to write. But if you are not committed to being a lifelong learner, this medical coding is probably going to be something that you find very difficult. Even if you eventually become committed to the process, I think in the beginning, you're going to definitely have that hesitation because you really need to buckle down. It's not what you think. It's not, well, I know somebody's a medical biller and coder and I don't think they're smarter than me. No, don't even go there. You don't know what that person is capable of. If they got a certification, you do not know what that person is capable of. So take it as an opportunity, if you know someone who is a medical biller and coder, to find out um, someone in medical billing and coding or someone who has a medical coding certification, to actually find out, like, what is this about? You'll learn so much from individuals, even on the medical billing and coding side, where you're talking to someone who actually does that billing piece. There's so much to learn from individuals who work in these industries that is way beyond what you do as a nurse. But if you really think and you use your critical thinking skills, you'll be able to make the connection between what you do and what they do, because we're all in one system together. So I strongly promote the systems theory, where we're all players in a larger system. So you have to understand those people, the purpose, the place, the process, all of those P's in the system theory, to see what role you play and the roles that other people play, so that there's a loving relationship. Like, I understand what you have to do, I understand what I need to do for you to do what you have to do, so you can understand the workflow and, again, the entire system.
And then you had mentioned, like, and you made a very good point about not knowing, assuming, and if someone is certified, you don't know what they know in terms of experience and knowledge, and that is really
Yes.
true because as you being a certified coder, that this is not um, coding exams are not easy.
No.
They're not a walk in the park, and I find them to be, first of all, they're as long. Well, no, not as long because it was all day, but it was. I'll say it was as comprehensive as when I took my NCLEX.
I
It
would
was
compare it to an NCLEX exam, definitely.
absolutely. I mean, it is no, like, when they talk, when you read the objectives and when you read the domains they're going to cover and the topics and information, they cover every single one in some way, shape, or form. They hit it all. I don't know how they do it, but they do. And it doesn't, and you have to come at it with some respect. You really have to come here, like you said, with an open mind, because it is, first of all, is very doable. And I don't, if the average nurse really knew, if they could peek into our minds, Raquel, for just 2 seconds, they would see how close they are to a brand new career. Like, they're right here,
Hmm.
but but it's not easy to get from here to here. Like, you got to work to
You got to
get
work.
there.
You got to
And
work. Yep.
but they are so close, and all they have to do is just put in some concentrated effort for like 3-4 months. You could have a whole new life.
A whole new perspective. You can approach nursing and healthcare from a perspective that is so unique. You'd be surprised. I would probably say, you know, you could probably do something as silly as record yourself talking about how you feel about being a nurse prior to learning about this information, and then, like, give yourself like 6 months later, and come back to record how you feel about nursing. After you began your process in studying. And the reason why I say studying, because before you get that certification is a demonstration of what you know. Prior to that, sitting for that certification, you need to be bad to the bone before sitting down for that certification. Now, I do not knock anyone who has to go and take that exam over and over again, because if that's the process that you have to go through, it is indicative of what you need to know. And if this is something that you really want, go after it. Go after it. But I will say this: I think that it's something that you have to be so committed to, that for yourself, even though, you know this is new for me, I know that this is something that I can actually do. And I'm telling you, as that process begins and you start studying and learning this information, you will change the way you feel about healthcare. You'll change the way you feel about yourself, because you will go from not knowing and ignorance, complete ignorance. It doesn't matter if you're working in healthcare. You're going to go from ignorance to knowing. And when you
Right.
know, you will look at things from such a different perspective. You will understand why it's so important to be accurate in what you document as a nurse.
Right.
Even
You
though
know,
even though your documentation as a nurse is not what coders are coding on, you will just feel a certain accountability and responsibility. You will definitely understand the integrity of healthcare information and why it is so important to be accurate and precise about what is said about a patient, and even in your approach and care for a patient, because of the fact that that accuracy really is, it's like a hallmark of medical coding.
now we have a comment from Shade Stress, and she said, "Isn't it unfortunate that in nursing school they don't teach you anything about coding?" It is unfortunate, but I also think that's the design. Like, nursing doesn't, they don't want you to do anything else but nursing. They want you to eat, drink, sleep, and breathe it.
Right. That's their job. You're right. That's their
Right.
job. Their job is not, because they understand that if you take your nursing information, and you're in a finance department, you're not doing nursing. You're in a finance department. You've leveraged your nursing knowledge and your knowledge about disease process and medication, and you leveraged it to do something different. And you are perfectly right, Jesse. You're perfectly right. That is definitely something. That is something I feel like it's not even simply just medical coding alone. I feel like this is also the problem with even technology, the discussion around healthcare technology within nursing. You'll get training on how to use a Pyxis. There'll be, papers they'll ask you to write evidence-based papers on integration of technology in healthcare and ways that technology can improve healthcare. But I honestly think that the educators, the tendency, at least what the data is showing, that the tendency is that the educators, they're between the ages about 60 and 65 on average, um, and they dominate nursing education. And those educators have not committed themselves to learning anything more than what they were told when they were in nursing school themselves and went through the process. So you may be lucky enough to have some that have been nurse practitioners, so maybe they have did some prescribing, they worked in that capacity. But as far as them being able to teach their nursing students, like what they need to know so they can be dynamic when they graduate, most of it is heavy on the med surge, heavy on ICU if you're lucky as a nurse to get an ICU. Very very heavy on the inpatient. And I'm recently hearing that there are more nursing programs that are integrating, at least what I'm reading and what I'm seeing, they're integrating, doing more of that community base. So they're helping nursing students to kind of see that those options working, community based care, which I think is awesome. But again, technology and specifically medical coding is an area where I feel that nursing curriculum really struggles. And I hate to say it, but I think a lot of it has to do with the nurse educators themselves not feeling comfortable teaching that content. And so that's going to have to be, I don't know if they're going to have to, curriculum should, or institutions, nursing programs should try to appeal to nurses with this background to, even course to teach a course or something. I think they're going to have to actually start bringing nurses that have medical coding certifications in to teach the information if it's going to be taught. And that's a big if, because like you said, Jesse, it could be by design that they don't even want them to know anything about it.
Because I think like my word for 2022, I've been saying it all year long, is gatekeeping. And
Mm,
you and I have talked about this in HIM and in nursing. It's gatekeeping is like it's like next level.
yes.
And so like the only way change really can take place, it really is from the bottom up, because the top, they're in their little ivory towers, and they're not changing. Like
No.
you can't. They have to just fade away. You just got to just give them time to just wither away, because they're not open, and they're not even reflective of what is even going on in society. So I mean, because look at all of the outrage that nurses have across the board, and we have all these state boards of nursing that don't issue statements, don't issue mandates, don't issue any kind of supportive nurses or any kind of just anything. But when you look at it, just like you said, when you look at the average age, and you had a lot of people who are upset with the expert witness in the Redonda Vault case. That lady was old as I don't know what.
Mm,
And you're
hmm.
an expert witness? How can you be an expert witness if you have not had any recent clinical experience? It's impossible.
And it says
Med-surg
so, yeah. Hmm.
med-surg in 1990 is not med-surg in 2020.
You're right. The expectations, nursing education should reflect the expectations of, I should say the expectations, but the advancements, that's a better word, of the larger society. because the nurses are going to be expected to interact with the public, and the education has to be relevant. It has to be relevant. It has to motivate the nurses to apply their nursing skills to today's problems. So yes, I mean, for all case and purposes, if you have an expert witness, and just, disclaimer, I did not hear what this expert witness said, so I would like you to actually, um, actually explain that. But I would, I would, I would definitely see where there could be a problem with you having someone who is not even speaking about what is going on within, like, the societal influences, because they're there, right? So it's like, for example, um, there's an expectation that technology should work a certain way. You have an expectation, if you're interacting with technology all the time, when you go home, you continue to interact with technology all the time. If you are of an age and of a mindset on top of that, because it's not really an age thing, but more so mindset, where you're not really interacting with technology, maybe you're just like, oh man, I just need a phone. I just need my phone to ring. You may think it's quite fine for a Pixis not to work sometimes, because you're gonna go back and say, well, oh, I remember when we were doing it with just the paper. Oh, the Pixis ain't got to work. We could just do it on paper. Where in our generation, we're gonna be like, wait a second, the Pixis is not working. Like, oh no, well, how long are we gonna do this? Because sometimes, some more older seasoned nurses will be the first ones to kind of tell you, oh, just because that thing is down, don't mean we can't, buckle up and go ahead and do this work. So, so that it has its benefits when you have more seasoned nurses to kind of tell you, come on, that's not working. Come on, we can still do here. We can, work around that, whatever. Because I used to run the whole floor without a Pyxis. But if you understand, again, in a certain time frame, you're looking like, today's society. I mean, you have nursing students. I remember when I was teaching, nursing students would come to the clinicals, and we had, I graduated in 2011, right? But then, the nurse educators there were seasoned women. It could be my grandmother, could be my mother, right? These are seasoned older women. And I mean, you had to come in there with your watch on, your white socks, your white pants, your white scrubs. I mean, that's how you had to do it that way. When I was teaching, this was back in 2007 or so. Well, no, not 2017. The nursing students was coming in the clinicals, putting their phone on the bed, saying that they checking the pulse with the phone, with the clock on the phone. Coming there without a watch on. Some of them they had the phone with them because they had an app on the phone to look up the medications. Even me, I had to process that, because I'm looking at this like, so you didn't write it down on a 3x5 card. You're just gonna come in here with your cell phone in front of the patient talking about, let me look at what that and it's in the optics of it. For me, it just looks like you're surfing on your phone. So it looks crazy to me. And then you seem like you're not prepared. It seems weird. But for them, it's just like, oh, I'm just looking on my phone. I have an app. This is fast. Like, this is the best way for me to get this information. So even in that example, you can see how the influences of society impact how today's nurse is going to practice, and the expectations that you're going to see in today's nurses. So
And,
yeah. Hmm.
and now that point right there, how you just said that the students were using technology a lot more. Can I tell you that makes them prime to switch over into medical coding? Because believe it or not, it is a lot of technology that you utilize in medical coding.
Hmm.
Like, I have multiple screens. You might have like 3 or 4 applications up, 2 applications on each screen, and then maybe one on your work laptop. You have to do a lot of interaction. You have to do a lot of, combine cutting and pasting and moving here and moving there and looking up this here. And so the older the older nurses have a problem with technology just because of, they're not familiar with it. But that in and of itself, like just being able to manage technology is a transferable skill that a nurse should have if they want to transition into medical coding. Knowing how to, you know, even open multiple applications, knowing how to move, what one application from one screen to another screen, knowing how to even set up multiple screens. I mean, it's just you have to know these things as a coder, especially working remotely because you don't have anybody coming from the office to your house to set it up. Now they have tech support you can call; they can walk you through it on the phone. That's about the best that you're going to get.
Of course. And especially if you're working in a capacity where you may have to do reporting to someone about your productivity, you're going to have to be very comfortable with Excel. Excel is a very powerful tool. I was just in a recent AAPC chapter meeting, and the speaker was talking about how how much she has learned, the power of Excel, and I can definitely speak to that because if you are creating reports and you understand how to use something like Excel, for example, to create tools like Excel or Google Analytics, you can, create pivot tables, you can, do calculations, you can create um, visualization tables for whoever you're reporting to get a clear idea of what it is that you're looking at, especially when you get in around conversations or responsibilities that align with CDI work, for example, where you have to look at numbers, you're looking at rates, and you're looking at um, reporting very specific data for tracking and trending purposes. You really want to be comfortable using technology and using tools that actually helps tell the story of the information that you're, reporting to whomever you have to report to. But I think, like you're saying, I think even with Google, I find that if you are if you use Google and a lot of the different Google applications quite easily, you'll find using Google Analytics very simple, even if you're just completely new to the concept, like Google Analytics. Well, what is that? It's just like Excel. It's just like Excel, but it functions similar to the way Google functions. When you start typing things in there, it starts predicting. You're trying to type in this code? Are you trying to look for this? Are you trying to look for that? You can create tables. You can move columns around. You can, create pivot tables. I mean, it's great. But again, where are the nursing educators who are comfortable with those tools to promote the utilization of those tools to help nursing students be prepared in that way so that when they come into the workforce, they are saying, oh, you know what, I could explore this option because of what I learned in school. I think I can do this. So I think, if they need somebody to do a manager role, even if it's like charge nurse, let's look at something like that, because that is a role that is very easy for a nurse to jump in nice and early. They'll you be fresh out of school and they actually be a charge nurse. So you have to be comfortable with reporting, and if they tell you that they want that report on an Excel spreadsheet, don't look at that as a limitation. I don't think I can take that job. They want me to do an Excel spreadsheet. I don't know what they're talking about. There's so much information online, LinkedIn Learning, where you can apply, where you can learn how to use Excel in ways that you probably never imagined you could use Excel, and it will show that you are on top of your game. But I do have a question for you, Jesse. Could you
Yes.
elaborate a bit on what was observed in that case, that Redonda Vault case, when you were speaking specifically of the expert witness?
Oh, specifically, it was her. It was about you know, her length of time since she's been working. Like
Oh, okay.
the attorney Redonda's attorney was asking her questions, and she didn't seem to like. They seemed to get it seemed to be like a little hostile exchange between the two of them when he was asking her specific questions about her knowledge of Pixis and the
Mm,
override features and things like that, the technical aspects. And it's
Understood.
because she wasn't, she really wasn't, she's not a Pyxis expert. But
Exactly. Understood.
I,
Understood.
I just, I mean, it's a very unfortunate situation, but that has also, but also what it has done, what that case has done is it has driven more nurses to consider other occupations away from the bedside because, like, since her, since this whole case has come to the forefront, like I've gotten a lot more inquiries on my website. I have a lot more people reaching out asking. I have a lot more nurses reaching out talking about how they want to do this. I have this, I have experience with this. How should I pursue it? What should I do first? And they have no clue. And it's a shame that you really cannot go anywhere and find definitive information as a nurse on what you should do to move into medical coding. It shouldn't really be that hard. Like
Yeah.
there's a gazillion websites you can go to if you want to. If you, even if you're an associate's prepared nurse and you want to get a master's, you
Hmm.
can find accelerated programs up to wazoo. You can find this, you can find that, but go try to find how to transfer from nursing to coding. You cannot get any concrete information.
And that's so unfortunate because that would probably be, if you want to know the simplest way to get to six figures, a six-figure salary without occurring a lot of debt going through, like, I guess, a traditional institution, uh, that process where you're picking up this degree and that degree and this degree, it would be that. I would say
It sure
go
would.
you become an LPN. After you become an LPN, go get your medical coding certification. The gatekeeping in those processes, LPN probably more gatekeeping, but medical coding, no, none at all. The door is wide open. It is come one, come all. Many jobs, few workers. So it's not, you won't have a hard time. And you being a nurse is just going to be like a golden star, because now when you come in and you get to sit amongst individuals with other added expertise, and you intersect with them with medical coding. Not that you're going to come in and say, oh, well, I'm nurse know it all. No, you're going to come in with your nursing knowledge to add to the conversation around revenue cycle, around coding, around reporting, and maybe even around CDI. You're going to be able to add to that conversation. And then you'll have your analytics people coming in, and they'll be speaking on their piece. You'll have your financial people coming in, the people from the finance department, they'll add their little piece. You'll have your HIM people come in, they'll add their piece. And so everybody's where case management, care coordination, everybody's going to have their little piece to add. But now when you're coming in and your tool is medical coding, that's a very powerful tool, because medical coding is it transcends um, just simply the actual activity of coding. You have that reporting piece to it. You have the data piece to it. You have the data integrity piece to it. You have the chart review piece to it. That's an industry in
What
itself.
what is an industry in and of itself, and what it really comes down to is once you leave the best, like I tell all of my classes, once you leave the bedside, because when you're in nursing school, they don't teach you anything. You have no regard for revenue, none. You don't care how much gauze causes. You don't cost. You don't care how much medicine costs. You just go and the patient needs it. You give it to them. Care is not defined in terms of money in nursing when you're learning it. But once you leave nursing, once you leave that bedside and you go to the other side, it all is about money. That is the ultimate end, to improve the revenue cycle. Period. Point blank. And everybody plays their part in the other side of it, and even nursing. By improving the revenue cycle, you improve the revenue cycle as a nurse when you wash your hands
Mm-hmm.
between patients.
Yes.
It's just that simple. And because you cut down on hospital acquired conditions, which
Of
will
course.
affect your revenue.
Mm-hmm.
And it's just amazing. We have a comment from Glass Gloss, and she says that case has me here today, but don't get me wrong, I've been interested in coding for a year. Well, thank you for attending.
Thank you for attending. Yes, definitely. Please spread the word. Glass Gloss. because
Yes.
this is what we focus on. We focus on getting nurses to that next space. Mm-hmm.
So, um, so basically, Glass Gloss, what I could say, the first step in a nurse, especially if, as a nurse transitioning into medical coding, the first step is ICD-10-CM, point blank, period. That is the foundational medical coding course that starts it all. You have to know ICD-10-CM because that is the code set that is used everywhere: inpatient, outpatient, home care, hospice. Everywhere you go, you have to have a disease code because that establishes medical necessity for a payment for a procedure. So
Amen.
you have to have ICD-10-CM. It starts there. Now, what I did, excuse me, now what's interesting is when you go to a community college per se, and that's why we need to have more entrepreneurs like us, Raquel,
Of
because
course.
when you go to a community college, they will not let you, even if you are a registered nurse with a BSN, they will not let you just take a coding class. They
Right.
don't do that.
Mm-hmm. They have to sell you the whole package.
Exactly.
Mm-hmm.
So why would you have to sit through? And honestly, because I was going to go back and get I was going to go to get my RHIT, and I'm like, okay. So I was all geeked up. So I'm like, okay, well, let me. I had a whole list of classes I was ready to challenge. I'm like, okay, I can challenge that. I can challenge that. I can have this done in like less than a year. Until they hit me with, oh, you can challenge, but if you challenge over a certain amount of classes, you can't get a degree because you have to complete a certain number of credits here. It's all about money.
Yep. Yep.
It's not
And they
about,
had.
it's not a,
Yep. Mm-hmm.
so that's really that was another motivating factor for me to create the coding nurse, because why do you have to jump through hoops and spend extra money to transition when all you really need is an ICD-10-CM code set if you want to do risk adjustment or home health, or you can take that and then there's other places you can go. You can go online and take a CPT course.
Mm-hmm.
There's people who have them. But what I have found is it is very, very, very hard to find a comprehensive, thorough ICD-10-CM course. That's why I have all three, but that's
Mm-hmm.
really why I created mine, because that is you save so much more time as a nurse. You take this course, you go and sit for this exam, and you go get your resume redone professionally, because now you have transferable skills, and you get on with your life. It's
And you
easy
are so right
breezy.
about those transferable skills.
But they make it hard, like these schools, because it's all about money.
And it's even more so about money now since the rates of enrollment have gone down.
Right.
And I mean, even when, and here's something to explore, for example. I know recently I took a data analytics course about this time last year. I had completed the course, but it was a course that was it was a condensed course that was just the core information you needed to know on structured query language, business data analytics, and Tableau. It was a very condensed, very to the point course, but it comprised of those three courses, and the program comprised of those three courses. And for me, I think that if you are already in a profession, you're already a nurse, right? You're licensed, okay. Why go the route of going way around and going into this institution that even now these institutions are breaking these courses down? Because the course I went through was with NYU. Um, but there's so many other universities that present these condensed courses. If you want to learn about Python, you want to learn about, you know, R programming. However you want to, what you want to learn about coding, these are programs that they take all the fat out and they just give you just the meat and the bones. And so that's what Jesse is talking about. Essentially, he's talking about cutting away the humanities course. Because guess what? If you decide that you want to go to school, you're going to have to take humanities 101. And you're going to be sitting in a humanities course thinking, like, I can't believe I'm paying for this.
And do you know, like in back in 2000, during the height of the IT boom, I went to school and I got my A plus certification, my Network Plus, my MCSE, and it was then that I realized the benefit of certification because they teach you what you need to know to perform these technical skills,
Yep.
and you are job ready when you pass that exam.
And wouldn't you say that you can sincerely see how it revolutionized your mind? Like, I'm sure you had to give yourself a pat on the back that you were even thinking about that when you were thinking about it. That because the fact, see, oftentimes we need to give ourselves at least some grace that we were thinking about something, that something actually crossed our minds, because it's at that point, like what Glass Gloss is saying, when she's saying, you know what, I've been thinking about coding for a while. Kudos to you for thinking about it, because the truth about the matter
That's
is
right.
there are many nurses who they're really between a rock and a hard place. One nurse in particular, every time she sees me, this has been going on maybe since about the past 2 years. Oh, I'm gonna link up with you about that medical coding, Rock. I'm gonna link up with you. I'm gonna link up with you. I'm gonna link up with you. So I was telling her about CDI for a while. I was saying to her, you should probably consider going that route, because she was going back and forth where she wanted to go to school and be a nurse practitioner. But the truth about the matter is, she could not complete the program. She lost interest in the program. Now you've taken a few classes that don't transfer to anything. And in that time, you could have taken a single course about ICD-10 CM coding, and you could not only apply that knowledge to a course, you could actually be preparing for a certification with that knowledge. Because the beautiful thing about being a nurse is when you have this information, and this goes back to the gatekeeping you were talking about, Jesse. When you have this knowledge, you actually can apply for different positions, because now when they ask you, well, do you know about this, do you know about that, you are telling them what you know. See, because the person on the other side of that table, when you're telling them that you want to move away from the bedside, they know if you know what you're talking about.
Raquel, let me just jump in. Can I tell you the biggest flex, the biggest hack is if you are a registered nurse to get into CDI, it is so freaking easy for a registered nurse to get into CDI right now. I'm going to say right
Hmm.
now because things change.
Oh yeah.
And all you need, like all roads lead to ICD-10 CM. You
Hmm.
cannot do CDI effectively if you don't know how to code. You cannot, you are, it doesn't matter what your clinical background is, but if you don't know what the guidelines say about sepsis and how to code sepsis versus severe sepsis and what
Hmm.
constitutes septic shock, you're useless.
Right.
If you don't know that you have to, that heart failure is qualified by type and acuity,
Hmm.
you're useless. And if you
Hmm.
don't know, so those are things that you learn in an ICD-10 CM course.
Of course,
And
that's the 101 of ICD-10 CM.
and in my ICD-10 CM course, I also incorporate um, reimbursement methodology. And when
Nice.
I tell you, I give them the game. I'm like, I said, you all, if you all really were on it, you could take the information that I'm telling you and finesse that into a CDI job. Because first of all, when you look at requirements, the most requirements right now say RN.
Hmm.
RN, that's it. And you have to have an acute care background.
Hmm.
Now, if you come in from as a coder, they want you to have a CC. You don't have to have a CCS if you're a
Hmm.
registered nurse. But you do have, and Raquel, I teach them.
Hmm.
They just had a course last week. I mean, a test last week. I teach them how to manually calculate MSDRGs.
I know that's right.
So I tell them, listen, if you get an interview and you sit in front of across from this lady or this man, and you tell them what a CC is versus an MCC and how it impacts the MSDRG and what all the other components of the MSDRG, like the discharge summary, the discharge deposition, the discharge diagnosis, CCs, MCCs, If you talk like that and you give them some clinical indicators for sepsis and give them some clinical indicators for acute kidney failure, you are in like Flynn because they know you know what you're talking about. I've read articles where I've had nurses contact me because they've gotten CDI positions and know jack about coding and they want a crash course. You can't crash course coding.
No,
It's too intense.
no.
You need to.
You can get away with a little more, like you said, with CDI. You may have, like for instance, and you know exactly who I'm talking about. I'll just use the buzzword LinkedIn, and I think you know what I'm talking about. So there are accounting groups, right? Public accounting firms that bring nurses on, and when they bring nurses on, they're bringing nurses on to do this CDI work, and they're being managed and supervised by nurses who are certified as CDI. So it's not like they're bringing nurses on, everybody's guessing their way through it. But I'm saying this to say, even with just your knowledge, you can have the opportunity to be mentored by someone who can give you that information to help you get into a CDI role. And I mean, again, I just said public accounting. This is you're talking about, you want to get away from the bedside. This is a public accounting firm that is hiring nurses, and this is not a unique situation. Public accounting firms that have nurses working in that CDI role, this is how they do it. And they have you working up under someone who's going to show you. They're going to hold your hand and they're going to walk you through that process. So the opportunities are definitely out there. And Jesse, you are right on it. It's about what you know. And if you invest in yourself the way you invest in any other part of who you are, or how you want to be, or what it is that you want to become, or what you want to experience, how you want people to deal with you or interact with you, invest in your education, because people will respect you when you are demonstrating that you know what you know, not just saying, oh, I've been working here for 10 years and I never get a promotion. Well, they probably were never considered for promotion because you've mastered only what you currently do. So you have to demonstrate that you want to take it to the next level by your investment in yourself.
We have a question from Glass Gloss, and she says, is CDI and a nurse auditor a type of medical coding?
No. CDI is not. Yeah, CDI and nurse auditor. No, that's not a type of medical coding. So when you're thinking about medical coding, you want to think about organizations like AAPC, the American Academy of Professional Coders, and AHIMA, the American Health Information Management Association. This these are organizations that they give out these coding certifications. You can maintain them with your CEUs, and that's essentially what you need to consider when you think about a medical coding certification. So actual credentialing organizations that give out these certifications. And these certifications allow you to do this medical coding where you're applying your knowledge, your ICD-10 coding guidelines. That's what the medical coding piece is. CDI, you have to understand medical coding, actually, but CDI, you don't even have to be a medical coder. Just like what Jesse is saying, you don't have to be a medical coder. You can actually be a nurse and have no coding certification and go into CDI, because CDI is one role.
Right, but you have to know the ICD-10 code set.
Oh, you better know, honey. You better
inside out.
If you want to get past that interview.
And because honestly, CDI has become so broad that you have to break it down. And I'm going to do a video later on. But CDI has to be broken down into inpatient versus outpatient, because how you get into CDI in inpatient is not how you do it in outpatient. It's totally different. Because inpatient, you need to know ICD-10 inside out, but you also need to know ICD-10 PCS, because the reason why you need to know ICD-10 PCS is because there are some bedside procedures that will increase the DRG. So you need to know how to how to code that and how to find out. And it's very easy in the code book. This is the
Mhm.
thing. Like when people give you when you are taught by people who know,
Mhm.
like us,
Mhm.
you know, because they make it so easy. In ICD-10 PCS, they have body parts. They have
Mhm.
a 7-character system. They have
Mhm.
they have a column called body part. If the body part is shaded in purple, that procedure will increase the DRG. How freaking hard is that
Mhm.
in a color coded book?
Mhm.
I mean, it's
And
just
building the code itself with the PCS is actually quite fun if after you start doing it.
right. I
Um,
actually, I
mhm.
actually like PCS, but way better than I like. I don't like CPT. I never have.
And then to your question, also glass gloss about nurse auditor. And so a nurse auditor may work in a capacity where you're doing more like record reviews and you're looking over the documentation for validation. For example, you may even see roles. I've seen a few floating on Indeed recently, in Indeed.com for chart review nurse. And in those roles, you will be looking at a specific set of criteria, similar to HEDIS, but not quite HEDIS, but similar. But you'll be looking at a specific set of criteria for what should be in the documentation to demonstrate that a particular care has been provided or that it was, met to the patient's, expectations, how the patient responded to the treatment, if there was a problem that was highlighted, but there was no documentation that there was an intervention applied to the problem. That's the kind of thing you would be looking at as a nurse auditor. So it's not a type of medical coding, but interestingly enough, uh, the medical coding piece is central to CDI and some nurse auditor roles. So that's a interesting that you put that all together, Glasgow, because they do work together, but they are
Right.
three individual things you actually did highlight here.
And they're not all, none of those roles sit in the same, they're all not in the same department because
Right,
CDI is not part of coding at all.
right.
And because when people think of medical coding, like in the industry, when you think of medical coding or a medical coder is really thought of in terms of production.
Right.
Like you're a production coder. All you do is you code encounters all day, and you have a
Mhm.
criteria that you have to meet that for that, hourly. When you move into auditing, auditing is a step above production coding. Auditing is this work. This chart has already been coded. I have, I have demonstrated skill and I've mastered these code sets. So I am very good at picking out what somebody missed. So I'm
Mhm.
going to go over it. I'm going to do a more thorough, like a second check. And each time you go up, your productivity rate goes down because you have to give a more thorough look. You do a more thorough, intense review. So once the auditing is done, then any findings, then that's when CDI gets involved because then if because auditing only does auditing in the truest sense. Auditing is not supposed to do patient provider education. They're not even supposed to do coder education. All that is supposed to come from and through CDI
Exactly. Mhm.
because CDI is actually the liaison between the providers and the coding department. Period.
Mhm.
They do the that they're the ones that try to cajole the doctors like look, this documentation is really not it.
Mhm.
You know, you know, we have to work on how you know how you code pneumonia because you're not you don't specify it enough
Right.
type of thing.
And also with CDI, again, going back to that reporting piece, it's very much on you demonstrating that the revenue impact, being able to understand the financial impact of what is documented or not documented, because it's only in what is documented that the coder can code. So you actually need to not only have the clinical indicators to support what is being coded, because again, when you're thinking about CDI, and even that piece where the nurse auditor, you're looking at reviewing documentation because you want to make sure that there's support for what is being coded. But you also want to ensure that you are demonstrating, not the nurse auditor, but this is with CDI, that your what you reviewed and what you are paying attention, what you're highlighting that needs to improve in the documentation has a financial impact. Um, and again, that goes back to those Excel skills. Now, just think about this. Just envision this. So you take Jesse's course where you learn about ICD-10 CM coding and reporting guidelines, and you start learning about coding. You start coding scenarios, and then imagine if you now take the time to invest in learning about, let's say, Excel spreadsheets, right? How to use an Excel spreadsheet, right? And you start talking like someone who's making those connections. You can start looking at what the job market looks like. And I'm not saying that you're going to jump out there and apply for a position and if you're going to get a position, but start thinking about the skills that you actually need to have to make all of this come together. Because when you are applying for roles such as CDI positions, if you are interested in going that way, those are the kind of things that they're going to be looking to see if you're comfortable with managing data, if you're comfortable with ICD-10 coding guidelines, if you're comfortable with provider education, because those are all key components of CDI. And also looking at financial impact. You have to be comfortable with looking at that. I think that's, Jesse, you said it before, but I just want to double down on that. I think that may be the hardest part of it, because I think oftentimes nurses don't think about healthcare as a business. So we think about it because we've been indoctrinated to think about it as having a bleeding heart and being, oh, so caring and that healing, hand. And that's good because somebody got to do it. We can't just be all about the numbers. But when you start thinking about things a little differently and you start looking at the ICD-10 code and guidelines, and then you start thinking about how, like, oh, this is how this is work. This is how this, okay. You start understanding that you have a responsibility as a healthcare professional to be aware. There's some responsibility you
Okay.
have to be aware about the financial impact of the decision that we make in healthcare.
Now, I'm so glad you said responsibility because that's another piece that we have left out, that what you have to understand as a nurse transitioning into medical coding, especially if you want to move into like auditing and CDI, like the higher up you go, what you have to understand and what you need to know is that nobody else will know what you know. You will have to do a lot of educating, even with the other staff that you'll be in meetings with, even with these, you know, CFOs and CMOs. You will have to explain to them. They'll have some idea, but they don't know. And you have to have integrity because they will ask you, they will want to do things that are not compliant because they are truly trying to chase a dollar. And I, just left my CDI role for that very reason. I got tired of arguing. Like I'm not, certain things I'm not going to do. Like you cannot code strictly from a lab. You're not allowed to do that. The CMS says you can't do that. So why are you trying to come up with educational material for providers to come up with diseases from labs? You can't do it. Labs can be part of it. A lab is certainly a clinical indicator, but that cannot be the only thing.
You also cannot code from, or should not be, uh, reporting as a provider information that you're getting from members strictly because they told you it.
Exactly. And but see that's all goes from like I had I just had issues at my last job because people don't want to you have to be, how can I say it? People have to want to learn from you in order to learn from you. If they don't see it for you, they don't see it for you, regardless of what you know.
Hmm.
And case in point, we had, I worked at a place that had nurse practitioners. The nurse practitioners would put in the review of systems, which is not the physical assessment. So it's not the HPI, it's not the assessment, and it's not the physical exam where you can code from.
Mm-hmm.
The review of systems is what the patient states, what you just said.
Mm-hmm.
They used to constantly put in, like, for instance, like men who had prostate problems, they would constantly put in urinary frequency. Now, first of all, you and I both know that no lay person says urinary frequency.
Right.
You put that in there, but you put it under the review of systems because
Right.
allegedly the patient stated it. So then when you get down to the assessment, you're going to diagnose the person with BPH. Then, because now this new thing in outpatient is they want providers to also do the coding, which is a total nightmare.
Mm-hmm.
They always pick the wrong codes. You're going to pick N40.1, which is, benign prostatic hyperplasia with lower urinary tract symptoms. When you verify that in the tabular, you have to identify what the lower urinary tract symptom is. But you cannot, as a coder, code from the review of systems. I would send them a query and ask them to specify and have the clinical indicators, have the person is on Flomax, have this diagnosis is in the is in the past medical history. This is what you have in the assessment. But this information is this additional information is needed. They will call because they got mad. They will call my supervisor. So my supervisor is like, well, you don't have to query them for that. I said, yes, you do. Well, no, you don't. You could just put it down. I said, no, you cannot. So she didn't take my word for it. She went and wrote to the coding clinic behind my back. She went to the coding clinic, and the coding clinic sided with me. Now, I don't go around tooting my horn, but let me tell you, when it comes to paper, my paper is straight.
We know.
The brother here is an AHIMA-Approved ICD-10 CM PCS trainer and CDI trainer. Don't play. If I say it's raining outside, take a damn umbrella.
You say you got coding clinic on speed dial.
I'm not going to tell you nothing that's wrong because it's not what I say. It's what the book says.
Exactly.
So
and don't take it personal. Because the thing about it is, at that opportunity, again, and this is the provider education piece, that's an opportunity to learn. So now that's an opportunity to say to the person who's a subject matter expert, the CDI person, and say to them, okay, well, so why can't I put this here? And I'm sure they know that why they can't put it there, because I'm sure you told them quite plainly, we cannot code from the review system. So because the review system cannot be used to support this diagnosis, you need to write it somewhere else. Write it somewhere else. Send out the referral for the person to be seen by urology, whomever, if you need to, so that this can be coded correctly. But let's just not just go ahead and just do our own thing. Let's remix the whole thing. And so here's the thing, and this is a question I'm more so going to ask you. How often were you able to do provider education as far as training with them? Was it something that you did like a lunch and learn thing? Or for you, was it more so just your usual query on the spot provider education?
Most provider education is done one-on-one because, to be quite honest, their egos they can't handle group education.
Okay.
Because you have to use some examples of bad charting, and then why did you use my chart? So it just becomes a problem. So it's better to do it individually.
Of course. Okay. Because my thing about it is, if I query you, I can't imagine it be anything more personal than me querying you, because the query is not something I'm sending in a general email. I didn't CC the CFO on there. It just sent to you, query you, and you say to me, oh no, I don't agree with that. Which is another part of tracking and trending in CDI. Tracking and trending, provider agreement and responses to query. So that's CDI.
And what I have realized, and it seems like a very small thing, but the most important part of CDI, I'm going to tell you, believe it or not, is the physician champion. If you don't have a physician champion, your program will never be successful.
I could perfectly imagine that. The reason why I could imagine that is because if you don't have a provider actually saying, okay, this is exactly like you and I have a provider that we have in mind, a medical director that we can both think of right now. And I could not even imagine that individual supporting um, the CDI professional with, that specialist with getting all the providers on board because of the fact that oftentimes people feel like they're in more of a fraternity, once they're in a singular, profession. It's like, well, who is that person to tell us what we should be doing? And it's like, do I need
Exactly.
the people upstairs in the C-suite to come down and explain it to you? Because if I start telling these people the financial impact, then that's gonna be the next person you're gonna be reporting to. So do we need to go there? But again, I hear exactly what you're saying. Without that support, it's a no-go. Glass Gloss has another question here.
Yes. Says, when the both of you first began coding, were you as overwhelmed as I feel right now? So glass gloss, like, we need a little more information. So I'm assuming that you are a nurse. What kind of coding are you doing, and what credentials do you have in coding, so we can better help you? Because you should have some support. You should have had some kind of training and a preceptor.
Until she responds to that, I'll just let her know when I first started, I was overwhelmed. And I was overwhelmed because of the fact that it was new to me. Jesse actually was my mentor. So for me, I kind of lucked up in a sense where, as even though I felt overwhelmed, I always had somebody I could ask questions to. Even though I was completely new to understanding this side of healthcare, I could piece my ideas together and throw it at Jesse, and he could explain to me that's the right way to look at it, that's not the right way to look at it. And I mean, this was back in 2018 or 2019 or so. So this was a long time ago, but um, I was. But the thing that really helped me was I never stopped studying. I never let being overwhelmed be the reason why I did not apply myself to studying. Feeling overwhelmed to me just empowered me to study more. And I will say this, a lot of that probably has to do with the fact that I was overwhelmed my first day of nursing class. I mean, you can't tell me that when you buy all those textbooks and you see those long list of courses that you have to complete, that is not overwhelming. You're thinking like,
Yes.
am I going to survive? Somewhere in your mind, you even think to yourself, will I even live? Like you think to yourself, like, how can I go through all of these courses? But you got through it. So for me, I always think if I can get through that and get through nursing school, and I was a high performer in nursing school, but again, that didn't happen overnight. I'm your typical poster child, public school education, slipping through school because of great behavior, not grades, but just great behavior. And by the time I went to to college, I wasn't really taking college serious either. When I by my last semester and going into nursing is when I was taking things like deadly serious. That last semester, I decided to switch from being a history teacher to going into nursing. And my last semester of class was the highest GPA semester I had the whole time I was in school because I took all of my nursing prerequisite courses in a matter of a semester and a half. And by the time I graduated, I had all the coursework completed to go into a nursing program. Um, but again, to answer your question about feeling overwhelmed, short was overwhelming. It was overwhelming. But again, if I got through nursing school, I'm telling myself I can get through. I can get through this. This is just a matter of discipline on my part. And I'm not no spring chicken. So just to make that clear, I,
Well,
you know,
now, I think most people, well, maybe people don't know, but for me, like, I didn't take coding classes. I got on the job training, and our job did they did an immersion. It was like a boot camp, And it was 2 weeks. I learned ICD-10-CM in 2 weeks and risk adjustment. And at the end of the 2 weeks, we had two attempts at 50 questions, and you had to get a 94 in order to continue training for the last week. And there were a whole bunch of people because the exam was Friday. There were a whole lot of people on Friday, and there were less people on Monday when the third week of training started. And that was I mean, it's, you know, I got through it, but it was intense. But what I liked about it was I couldn't have knowing how I see people do coding education in school. I couldn't have done it that way. I would be in the same boat that these people are in. I mean, at least when we had our boot camp and our immersion, we were actually taught by trained coders, and they showed us how to go through the book, how to find subterms. They taught us the proper terminology from day one. You had to say non-essential modifier. You had to say subterm. You had to say main term. They just didn't play. They played no games from day one out the gate, and you had to learn. Now, granted, this was ICD-9, so there were far less codes than under ICD-10. Thank goodness, but the concepts were still the same. So it's just, I mean, because back then, like type 2 diabetes was 250.00. Man, so now it's like E11.9. But I mean, it was just really, really different. So that was how I learned. But I still take the bulk of how I was trained, and I made it. And that's really how I set on my course. And even how I how I was trained to break down scenarios is the same way I still work to this very day. And it's the same way I train people in my course. You have to know how to break down scenarios. It has to make sense to you. Like I tell everybody, like as a coder, before you open up that book, you should already know what you have to code. You just need to open up the book to find the codes.
Mm-hmm.
You should already know what your principal diagnosis is, what your secondary diagnosis is, what kind of relationships. Now you might have some instructional notes in the tab that you may or may not know, but the bulk 90% of your work should be done before you open up that book, period.
And that takes practice. If you if you are interested in just coding and practicing coding scenarios, that is definitely something I do with my services. But Are coding classes online or in the community? Jesse can answer that question. That question is, are coding classes online or in the community?
Both. You can find classes locally, and you can also find classes online. But I just like because this is glass gloss, so I mean shade stress. So glass gloss is in the same similar situation. I would say just do your research because all programs and all courses are not created equal.
Listen, okay, let's stress this real quick. Let's stress this real quick. You have to be very careful because, first of all, you have to understand that you're coming in. Okay, for instance, if you're talking about one-on-one sessions, I offer one-on-one sessions and group sessions. Jesse offers one-on-one sessions. I think that that probably is the best thing to do first, because if you have a one-on-one session, now it depends on what you're looking for. My certification is in risk adjustment. I work for an insurance company. I do care coordination and healthcare data analytics. That's my area. If you're interested in learning about how that all works together with risk adjustment medical coding, then definitely you can reach out to me, and I'll be leaving my contact information before we close out today. But if you know that you want to code in a particular setting, inpatient, outpatient, if there's a specific if there's like, if you're learning, if you've already done your research and you know that there's like s- uh, specific settings you want to code in or specific specialties you want to code in, I would most likely say to reach out to Jessie, the coding nurse. Um, the services. I'll say this. If you are going to go into a coding class where there's different people in the class with you, find out from the very beginning from that instructor what that instructor's plans are regarding dealing with the diversity of um, the students. So, for instance, if there's a coding program where someone fresh out of high school, for example, is also in that class with you, and you've been, let's say, a nurse for 5 or 6, 7 years, whatever. You already know you and that person have two different starting. You guys are two different starting lines. If that instructor has a process in place to meet with those people individually and to kind of, keep them on pace with everything, then you should be fine. If it's more specific, like the way the coding nurses courses are, I think that that's a little bit more easier because everybody's a nurse. There's kind of more so a clear starting line because everybody starts off a nurse. So we have the pathophys, the medical terminology. Even if those nurses are come from different backgrounds, the starting point is a lot further ahead than someone, let's say, straight out of high school. Because even if a person is not in nursing, but they have background knowledge in healthcare, pathophys, so they've taken a medical terminology course or micro or something. They will understand some of the things that could kind of stumble you a bit. Because if you're taking, let's say if you start taking a coding class, and this is not what the coding nurse, so I just want to be clear when I say this, but say if you start taking a coding class and the first week, um, you jump straight into uh I don't know, medical terminology, and then after that you start coding scenarios. So now, mind you, you're not even going through the guidelines, so you're just going straight through looking in the tablet or looking up codes because you're going to do multiple choice questions, right? This is a popular approach that drives me crazy. I don't even understand. You zip through medical terminology and then go straight into, let's just jump in a tabular. While you may hear people say that that's what you're going to do on an exam, it sounds sexy that that's what you're going to do on an exam. Yes, on the exam, you're most likely going to be going into that tab. You're not going to be looking in that index. However, even when you take that exam, the reason why you're not looking in the index, or you're probably not going to go and comb through your guidelines, even though you have the book with you, it's because you already kind of know that information. You've retained so much of that to your memory that you don't even know, it's like second nature to you. So you're already ready to look up the code. You kind of know where in the book you got to look for the code to get to where you're going. You're looking at that scenario with a whole different set of eyes after you've been practicing for a very long time. But if you are in a coding course where they're starting off like that, that is a red flag. That's a red flag because you're learning very bad habits about coding. There's no coding, none whatsoever, that starts in the tabular. It starts in the guidelines. And you have to practice looking in the guidelines, and you have to train your eye because not only the guidelines, but even in the index, the alphabetic index, there's a, well, different depending on what book you purchase. If it's Optum 360 or AMA, they have different shading for the subterms and main terms. These are the kind of things you will be practicing if you are approaching it the right way, for you to have that type of training before you go into coding scenarios. So if you see a coding class where the week 1 and week 2 you guys are already starting to code, you should know right then that by the time you're done that course, you're going to feel real empowered that you're going to go and pass that test. But don't be surprised if you take the exam and you fail, especially if they tell you, oh, you're going to take this class, and after um after 8 weeks with me, you're going to take your exam, you're going to pass. Red flags, red flags, red flags. Those classes are very accelerated. Even if you see somebody fresh out of high school in that class, don't judge them because you don't know what their background is. They could be smart as a whip and could have been training for this class. Those are classes that are very advanced. If you know nothing about medical coding, you're completely new to ICD-10 CM coding, first step is for you to understand those guidelines. So I would probably advise, go through the guidelines and understand those guidelines. This is if you're serious, you go through those guidelines and understand those guidelines. Then you reach out to somebody like Jesse Then you reach out to somebody like myself or whomever you feel comfortable you want to reach out to for a one-on-one session if they're offering such a thing. And then you sit down with that one-on-one session to plan out your educational needs to see if that is what their system is set up for you to do. But it's a lot of people out here promising success like this is a get rich quick scheme, and it's not. And the only person that's going to get rich quick is that person, because they're going to get your money from your bank account into their bank account strictly based off of them making you think that this is something that you can just know so quickly you don't have to worry about anything. No, you're going to be studying. You're going to be
And then
studying.
you made some excellent points. And then what they will do is once they take your money, your failure, they will put on you, not on them.
Exactly.
Not on that they didn't prepare you properly. Because
Mm-mm.
what people have to understand, and there are a lot of programs, and we don't even have to name names. You can do
Mm-mm.
research and you'll see. There are a lot of programs on, out here who teach you to the test. That hasn't been proven to work even in secondary school,
Mm-hmm.
because you don't learn anything. Yes, you pass the test, but what people like, I try to tell my students. So number one, I don't have multiple choice questions on my test. You have to code everything. If I don't tell you how many codes you have to have, I give you a scenario and you need to come back with the codes and have them properly sequenced, because that's real life. Real life is not multiple choice.
Exactly.
When you code Mr. Jones's chart, you're not gonna be able to select from, okay, but I can pick this. Okay, this looks right. Okay, I'll pick A. No. And then and at my job, like, they had a hard time finding, because they were looking for production coders. They had a hard time even with certified people, because they would give them scenarios, even when they passed the test, when they had their in-person interview, they would ask them how to index a disease, and they couldn't index because they don't know how to use the book,
Mm.
because they're so busy focused on the tabular.
And that
That
happens
how
from practice. That happens from poor practice from the very beginning.
exactly.
Somebody, and the worst thing is when someone who is certified and been working in the profession does that, because that gives you a false sense that that's exactly how it's supposed to be done. And the crazy thing about it is most people teach you the way that they've been taught. So
Hmm.
you may even pass the exam because they were teaching you how to pass the exam. But then you, again, like you just said, you go out in the real world and you're like, oh, I can't believe I'm still messing up on this. Yes, because you're still doing this the wrong way.
And I've even had jobs, because if you're a coder, you're going to have to take a coding test for a job.
Hmm.
And not all jobs give you multiple choice tests. Some jobs give you tests where you have to write out the codes. And if you don't pass that test, they're not going to hire you. It doesn't matter how many credentials you have. You won't
Hmm.
get hired. You have to know how to code. Point blank, period.
I hear you. Now, I wanted to say something because I know that this discussion is about what nurses need to skills they need to be a good coder or to become a medical coder rather. And glass gloss, we're still looking for your for you to
Uh,
specify. Did they give a
you know,
response?
in the chat, she said that she's just doing her research and she hasn't started classes.
Okay, I kind of had a feeling. Okay, okay. So, and just to answer your question, to that question from Glass Gloss, um, it is it is very important for you to have very good study habits for you to be able to think out of the box as a nurse. And there is a nursing box. So we do have a paradigm that we think about things as far as disease management, patient education, professionalism. You have to be able to think out of the box. Yes, you will still be considering disease management, patient education, and professionalism and safety. All of that will still be a part of it, but you have to think out of the box because now safety is going to be taking a different look. Even when we consider HIPAA, for example, that's going to take a different shape when you start thinking about medical coding. So you have to have an open mind. You have to be a very disciplined person when it comes to study habits. You have to also be willing to network with people. Coming onto this program and listening to us speak is definitely a great starting point. That should demonstrate to you and to anyone else listening that you are ready to learn more. So you have to have that commitment to being a lifelong learner as well. Of course, if I didn't say it before, research. Um, it's so important for you to feel comfortable. For example, I said it before, but I just think it bears repeating. If you don't have a problem just listening to someone from, let's say, CMS, they're doing a panel discussion where they're talking about some breakthrough initiatives that just going to start rolling out, that's going to be impacting revenue cycle or impacting coding. um, those are good conversations to sit and listen to. Sometimes there's even some videos I've seen on YouTube where you see individuals who are in the tech world, and they're talking about like different ways technology is helping to solve a lot of these issues around like the workflow and coding and HIM and HIT. Those are great opportunities for you to kind of, again, challenge yourself to think out of the box and look at something from someone else's perspective. I think that that's probably the most difficult part of that transition from nursing to medical coding, is that thinking out of the box and seeing something from somebody else's perspective, because nursing have been kind of trained to look at things from medicine, because we get our direction from medicine. So we look at the medical doctors um, opinion about something, or we shape the way we are going to approach something in alignment with what the is going to be best for the medical for the provider. And so with that, it's of course it's natural that nurses believe, RNs, LPNs believe, you know what, I think if I'm going to advance in my career, I should be a nurse practitioner, because it's just like, okay, now I'll be sitting in that seat as a provider to help lead, patient care. But again, challenging yourself to think out of the box. Even the providers need ongoing education, because all of the services they're providing has to be coded, it has to be billed, and that's exactly how you keep these doors open. That's how your facilities stay open, your hospitals stay open. And so all of this works together. So again, if you want to be a nurse practitioner, sure, I'm not hating on anyone who wants to do that, and I'm not trying to kill anybody's dreams. But if you want to transition from nursing into another area of healthcare where you can keep all of your nursing knowledge, just leverage it in a way where you're able to collaborate with other individuals who are more on the technical side of things. This learning about medical coding is, I can't even articulate, Jesse, how much it has changed my life.
Same.
I can't articulate that enough. I can't even. We would have to have a whole different program on just like for instance, I work for a major insurance company. Although we are deep down in healthcare data analytics, the people we report to, they don't know anything about risk adjustment and coding. When I say not a drop, not a drop. I say risk adjustment, and the person I report to says risk. She says risk. Every time I say risk adjustment, she says risk management. I mean, like that's how like that's how far out there it is for them. And I mean, again, my whole department um, is just completely focused on nurses pulling analytics from a population health database that we use, and pulling that information into a care plan and abstracting that information to create a nicely you know uh, uh, created, designed, care plan for us to, like, ensure that the members are getting everything that, we promised them as a plan. And they have to go in there and pull the CMS ATCs and put them on the care plan. And of course, provide the education that I feel like they should be empowered to know. And even with that, I know with many of the nurses, it just goes right over their heads. I don't give them a long-winded speech about it, because, largely their job is really about that care coordination and, connecting the members back with their providers and member services. But, So much of what we do is really about you understanding the risk aspect of this member. So it's like we have a big responsibility to actually make sure that we're getting as much information, especially the social determinants of health, those factors, those factors that are not medical in nature, but they directly impact one's access to quality care. And all of these are things that nurses are able to do if you want to transition from the bedside as well. But again, when you have a medical coding certification, you are definitely going to be looked at from a whole different standpoint. Let me just put a little tidbit out there. If you are an RN or LPN with a coding certification and you work for an insurance company, they're going to bring your butt to the top. You're gonna be going to the top. You're gonna be passing a lot of people. You're gonna be passing a lot, whoop, right past, because you're gonna be working more so in the finance department, and they're gonna want you to work in tandem with the analytics department because of the knowledge that they know that you have. I mean, because when you're talking about money, we live in a capitalist country, so you're talking about money. You're talking about, and like Jesse said, that's when you talk about medical coding, you're talking about money, which I think is another thing that is hard for some nurses because of that bleeding heart thing that we've always been trained on. It's hard for them to think about healthcare in as a business. You know,
True.
we haven't been conditioned to do that, Jesse.
Right. That's true. But look, we have been on here for an hour and a half, and I am just so grateful. Because you and I, we be on the phone for hours,
Yes,
and I really wanted to have this conversation because I want nurses, especially now, because there is such a there's such a major shift going on, and you have all these nurses who are like, oh, I'm getting away from the bedside, and I just want them to know that there are options, and if you want to move into medical coding, the best, like the takeaway, to wrap up, I think today the overarching theme is the skill that a nurse needs to have to become a medical coder is an open mind and
yes,
discipline. Those two things.
I have to
And
agree.
with those two, you can move mountains. So,
Yeah,
Raquel, do you have any closing thoughts?
I would say, so again, my services are a little bit more expansive in a different way than the services with the coding nurse. The coding nurse is where I personally get my information and my as my resource for the various coding certifications, and because the coding nurse has vast knowledge in medical coding. So that's my source for medical coding. My services are directed towards more working with you one on one and kind of seeing where your needs are. Of course, if you come to me, you say to me, well, I already know I need this, and this. Okay, well, you got to see the coding nurse. My services are more so tailored to kind of helping people kind of navigate their careers and see where they want to go. I do provide tutoring services if you want to understand CDI risk adjustment from, again, tutoring. So this is really referring to, the education, learning, teaching process. So if you have materials that you actually want to learn from, for instance, you have, let's say risk adjustment is an area of specialty for me because I'm a certified risk adjustment coder. Then I would definitely direct you. Please have those materials with you. We can go over the information that you have with you. And if you are interested in entering the healthcare field and you're not in healthcare and you may need assistance with, let's say, medical terminology, dosage calculations, uh, maybe you're interested in writing a research paper and you're kind of in a fog about where to begin with APA citations and uh, healthcare research in that area, please feel free to reach out to me. My website is www.acd4n.com. So it's just acd4n, just like that.com. I'm also on Twitter as acd4n_LLC. So I would love to hear from anyone who's interested in transitioning from the bedside. This is The reason why I started my services, because I wanted to transition from the bedside. So I want to extend, this freedom to you, because it has been extremely liberating. And Jesse is the person for me to thank. So thank you, Jesse, again.
More than welcome. We're gonna in the description box of the video, once it goes into replay, I'm gonna go and I'm gonna put Raquel's contact information as well as mine, and also I'm gonna have a link to an article that I think would be interesting if any nurse is interested in transitioning into a coder, just to have an overview of what this person who had written this article has to say. The person is not a coder, by the way, so just bear that in mind. But just read it, and just to get an idea, and it'll just really just encapsulate what we have been talking about today. So on that note, I would like to thank you all for attending, and please spread the word. Please follow the Coding Nurse. Please follow ACD4N Educational Consultant, and let's just spread the word, and let's just do it. We need more qualified people in medical coding and HIM. So if you're ready to make the transition, why not? Come on over.
Thank you very much.
Thank you. And on that note, I'll say bid everybody a good evening, and we'll have to do this again in another couple of weeks, Raquel. We'll have to come out with another topic.
I'm waiting. You let me know.
Okay. All right. Have a good evening, everybody.
Yes, take care.
Thank you. Bye-bye.